All right, stand by. I think we are live, but hold on, let me just double check.
Regina. Dexter. Oh, Dexter, we're live.
Are you on our Facebook page? Can you see it?
I'm not on Facebook, no.
Okay, I just want to double check. Hello, Facebook world, if y'all out there can hear us.
It
We
says
are,
live.
yeah, I see. I just want to double check it.
Where on the Facebook page are we supposed to see in the LA
LA,
South Twitter?
LA South Connections.
Mm.
Oh yeah, we're there. Yep, we are live. Okay, very good. So let me, Cheryl, or you go start letting folks in the waiting room. That's fine. I'm going to switch over screens here. Yeah, we're there. Yep, we are live. Okay, very good. So let me, Cheryl, or you can all start letting folks in the waiting room.
Let people in.
Let's switch over screens here. Very good. Yep, we're live. Okay, very good. Let me, Cheryl, or you can all start letting folks in the waiting room. Let's switch over screens here. Okay, please mute your device. You have somebody has some feedback going on. All right,
Here we go. Hello. Admit. We can go now, Dexter. Yay.
all right. Can you all hear me now? Because I was on mute. I was just talking my head off. All right. Good evening, everyone. Thank you all for joining our on Facebook Live and on our Zoom platform. Tonight is going to be a very exciting evening talking about health and wellness. This is a virtual health and wellness summit. Again, my name is Dexter McLeod. I'm with the Los Angeles South Chamber of Commerce. Hello, everyone. And
Yeah.
tonight's program is sponsored by our Hope Foundation, LA South Hope Foundation. So without further ado, I am going to pass it over to our health and wellness co-captain, and that will be Chef Cheryl Tate. So Chef
Okay.
Cheryl, you have the mic.
Thank you. Thank you. Good evening, everyone. Um, Happy to be here. I am so pleased to be a member of the LA South Hope Foundation, which is a nonprofit arm of the LA South Chamber of Commerce, wonderful Chamber of Commerce in the South LA area doing wonderful things. This is our virtual health summit. This is our first virtual health summit, one of many coming up in the near future. And our Hope Foundation is based on helping other people every day. And that is our mantra, and that is what we believe in. And this is why we have this Health and Wellness Summit, so we can address the situations that are going on in our community. We're in 2021 right now. We've had some interesting times. 2020 was an interesting year with all the challenges that we've had, and mainly in health. Mainly those challenges were in health and how everybody got along and how everybody was able to maneuver a COVID-19 lifestyle. So we're going to talk about health and wellness, and this is May, which is Mental Health Awareness Month. And we need to understand that health and wellness, mental health encompasses all of health and wellness, because if we're not processing right, if we're not thinking correctly, we're not making good decisions, and that impacts our health and wellness. So we're so honored and privileged that you're here to get this information. We have a great lineup of people that are going to talk about health and wellness and share their stories. And I'm a big person on stories. You know, we can learn so much from stories because that is how we really learned. You know, in primitive times, everyone sat around and listened to stories, and that's how we learned. That's how we were able to bring things into the future. So I am very, again, happy and just, you know, privileged to be here and talk with you about something that's near and dear to me, and that's health and wellness. So our first speaker, I do believe, is Regina White, and she is going to talk to us about mental health and homelessness. Regina has a lot of great information. From what I know, she has a radio show that she's been talking on for a very long time. And this is just one great person to get to know. She has an awesome story that she is going to share with us. Regina, thank you so much for being here.
Oh, thank you so much, Chef Cheryl. You made me blush. Thank you. I am the ambassador for the Chamber for the City of Long Beach, and I'm a proud member as well. And I welcome everyone who who are here in attendance today for this virtual health summit. Health and mental health and wellness and homelessness and all, it has a connection. The connection, what I'm going to speak on tonight is the connection between homelessness and mental illness. The two go hand in hand. What are the causes of mental illness? Most are environmental issues, and that's kind of how I got to be here. The causes of mental illness for me was my job situation. So what I'm going to do is I'm going to read something to you so you can get a better understanding. Okay. What are the causes of mental illness? Although the exact cause of most mental illnesses are not known, it is becoming clear that research for many of these conditions are caused by a combination of biological, psychological, and environmental factors. Mental illness is a diagnosis of a psychological disorder. It can happen to anyone because it happened to me. Men, women, and children. Environmental factors that we must be very much aware of. Since we've had the COVID, we have understood that we had a big pandemic that hit the whole world. And in that, mental health it's really talked about, but we're gonna need to have to address it. The most environmental factors that we're gonna talk about are death and divorce, one, dysfunctional family life, feelings of inadequacy, low self-esteem, anxiety, anger, and as well as loneliness are top factors. Beginning to talk about mental illness is a must. I have battled it 2001. I have battled it since 2001, and I was in denial that it even existed. It kept me from doing necessary things like providing for my family. The stigma of mental illness also created a hardship for me as well, because I was going to school to be a psychiatrist, to be honest with you. And when I just started to have these on-the-job issues, because harassment on the job is one of the number one causes. When you're working in an unsafe environment or you're living in an unsafe environment, it becomes to be a traumatic experience for you. So I worked in a corporate setting, in which many of you guys do, and I was being intimidated and harassed by a male coworker. Now, as a woman, a man, harassing you on any level. Now, these are things that we talk about today. In these offices, you see big profile people, most of it go unheard. For 3.5 months, I struggled with this guy messing with me. My coworkers noticed because I was the only woman of color in the day shift at the time. No one really paid attention. It started with my senior supervisor, which what my boss did, and this is what we must be aware of. When we're running businesses, we must make sure that our workers, our employees are safe. And that's where they failed me. They left me at bay. My senior supervisor did nothing. And then over a period of 3.5 months, I went from being just a normal, happy mother, financially driven. I had a great life. My kids were in private school. I'm private school educated. I never had a problem. I never even knew what it was, to be homeless or to be hungry or to not to have the simple little things in life that most of us really take for granted. And that's where I came in. In 2004, I finally went and got some help because denial is a large part of it. I was in denial. When I first heard about mental illness and I heard about panic attacks and panic anxiety and all of this, I thought it was just a way that people wanted to get out of working. I heard that people could go and get a check from Social Security. And to me, I had no feelings that I had no connection with any of it. So to me, as I walked over people downtown Los Angeles, stepping over them to go get my perfume and my nails and going to Macy's and so forth, I had no feelings for homeless people. I felt if I saw a woman out there with 2 kids, because I had 2 preteen kids, 13 and 14, the boy being 14, the girl being 13, the boy being 13, the girl being 14. And in those situations, there aren't any shelters, there aren't any places for a woman that has a 13-year-old son because he is of that age where they have liability issues. So you're never gonna find that particular type of shelter. So for years I struggled. I struggled with the whole idea of having to have to take a pill to get up, to think, to work, to motivate, to do anything. I had to take a pill. I was in denial of that until 2004 when I went into the Village ISA, which is Mental Health of America. I finally got some help. And when I got that help, I changed. By 2010, I went back to college and I changed that psychology degree to a human services major. And I took every course there at Long Beach City and I became familiar with what I had. One thing about being in denial, I didn't think, I thought that I could get over it. I thought that I could fight it. So 3.5 years, me and my kids moved 50 plus different states, 2 different states, 50 different places, living in parks, benches, you name it, I did it. For them to stay to school, we lived on the beach. Everything that we did, everything that I took for granted, I was now facing to lose. I lost it all. And in losing it all, they did an article about me in the Daily Breeze on November 30th, 2003. And from then on, I became who I am today. When I got to the Village in 2004, I began working with the homeless. I got out there as a homeless individual and I began outreaching. I became what is known as an outreach specialist. I became to know that these people out there were not just numbers, they were humans. Every year that we do that homeless count, yes, I attend. Those homeless counts are to be able to get a budget to help these people. And of course, you're gonna find people who don't want help. And at the first 2 weeks me out there, I learned very swiftly that yes, some people are out there because they want to. They get an income and they don't want to come in. But the larger part is what we're worrying about today, rent control. We have gentrification. These are things that are really highly amongst in our urban neighborhoods. These are things that you can't help. Low income, how much are employees making today? What is minimum wage? It's not even enough to afford your place. So that's where it all ties in. With mental health and your environment is at risk, that's where you get these where you're seeing a large influx of a lot of people living out there on those streets. What I will say and leave you guys with is never to think that it can't happen to you, okay? I've sat in many chambers and many city hall meetings with people, and I used to be that person on the other side who didn't want those homeless people walking through my neighborhood, didn't want to lose the value of my house, which at the time, just when you're living good, when you're on top of the world and you're financially set, these are things you don't think about, but it can happen to you. I do advise, as well as everyone else here, that we do have to find a way to be mentally strong as far as our mental health as well. I see, to everyone out there, I don't know if my 10 minutes are up. Are you keeping count with me, Cheryl?
You're fine. You can please. I appreciate your story. It's definitely one to be told. Please continue if you have more. Yes.
Oh yeah. Great. I'm gonna go ahead and share some things with you too. Okay. So, like I said, in 2010, I decided to go back to college, change that major, change to the human services, and I took every course that they had, ending with a 3.66. what people don't understand was before the job, before everything, I always had an education. And that's what served me right. And I thank my mother and them all up in heaven for giving me that, because had I not had that, then got the little bit, because you think you may know you might be streetwise, but being streetwise, you don't know anything. When I thought I knew it all, but I did not know where to go with 2 kids. I did not know what to do, because here people are telling me I'm fighting some mental issues that I didn't even believe in. And I tell you, it's not a punishment. It's not anything that God put on me or bestowed on me as for a crime, for punishment. And that's how I used to think too. I used to think, I'm like, what is that woman out there with those kids out there? She must be doing drugs. See, those things didn't happen to me. And that's why I became to understand that, you know what, your prejudgment of the next person, or you looking at someone and saying, oh, well, I know their life. You don't. And that's why today I started, not only, yes, I do have Gina's Groove Theory. I just made 9 years. It's a community radio podcast, of course, and I've been talking about these same very issues that we're dealing with the community today. And I'm very thankful that I do have all of you guys in this chamber and out, all of my friends who love and support me, who have supported me all these years. As I told you, that I will start a nonprofit to be able to fight homelessness from another whole different type of value. What I saw in those agencies when I walked through are the things that I took my agency and I said, I'm gonna change. So for instance, where I saw that they were lacking, like a revolving door, okay? You have Department of Mental Health, you have Mental Health of America. These people keep the same type of people coming in. It's the same thing that you say about any of the pharmaceuticals, same thing. If in fact, I need to make my money off of you, I don't care about that. We take homeless counts every year, and those homeless counts, now I'm gonna give you a little bit of information. In 2009, when President Obama became, after he became president, he signed in a bill called the Recovery Act of 2009. That Recovery Act was supposed to be for all states to either end homelessness or to prevent it. All those funds were distributed to all the states. They weren't used properly. What I see a lot of is the agencies tend to do what they want to do. I've vowed with all my breath to my last breath that I will make sure that every individual that comes into our organization, that they get help. Just like with the chamber. Every woman that comes in here, we get help. We help each other. We uplift each other. I can't say one thing. Mental illness can be battled if we do it as a whole. If we do it as a single, it's not me, it doesn't affect me, that doesn't work. That's not gonna help our society at all. You have to turn around and notice the little things. You might see some walking and they're not feeling too good. See, today I have that inept feeling to be able to look at someone and say, oh, he's hungry. Oh, she's homeless. Oh, she's going through something. But before, when I was living in my good life, I never paid attention to those people. I never even took out the time because it was all about me, mine, and my children. How do I make it? And that's why I'm such a community person today, because I did have that. It's all about me. Protect my own cubs and take care of everyone here. Make sure everything's going good in my house. But you got to realize that outside world can come into your house. It all it's a big melting pot. It might not be the melting pot that they fooled you to believe, but it is a melting pot within itself. And we all need each other to be able to combat whatever we're dealing with. One thing that we did learn from COVID, and I hope that most people did learn, was to be self-sufficient. Get out here, use your own talents, use your own mind, get with an awesome chamber like I did, like we did, and rock this world, rock your communities. Start paying attention to what's going on, because see, if we have a better community, that makes it better for our grandchildren, our children. I'm a first-time grandmother. And every day that I look, I say, what do I want for my grandson? How do I want him to be raised? When I look at women struggling with postpartum depression, we must be accountable for everything. Right. So with that, you guys, I'm glad to be of service, and we're gonna go ahead, and I think it's time for us to pass it on. I'm gonna go ahead and we're gonna pass it on to Chef Cheryl and Kevin Wilkes, and they're gonna be bringing to you your health, your youth mental health. They're gonna be talking to you about. So please give them a loud applause. Kevin, Cheryl.
Thank you, Regina, for that fine information. A lot of ones cannot relate to that until they speak with someone who has. but thank you for that fine information. My name is Kevin Wilkes, founder, CEO, and author at WLL Enterprises, Inc. We're a nonprofit organization, and our goal is to make sure our youth and their families live a safe and healthy lifestyle in undeserved communities. We're celebrating our 10th year anniversary this year of working within the community. I'm a proud member of the Hope Foundation, also of LA South Chamber, because they're trying to make a difference in the communities. Our one goal is to talk about is childhood obesity. Childhood obesity was not recognized really by the Association of Doctors until 2013 as being a disease that was rapidly growing out of control. You might ask, what is obesity? Well, obesity is measured by your weight and your height. And it shows that about 85% of our youth between the age of 5 and 13 were obese. Is it our kids' fault? No. Just look around. We see billboards, we see commercials, we see everything that directs us, our youth, and catch their attention to things that are unhealthy. What about give you an example. Can you go to a fast food place and get a salad for $2? No. But you sure can get a fries and a burger for $2, something that's unhealthy for you. So our kids are being steered away from healthy eating because of what they see on TV. Another thing is that a lot of parents, they're busy. Some are single family parents, and they work all day. What's the quickest way to feed their kids when they get home? Fast food. I'll pick up something on the way home, because they're too busy to be able to cook a meal. And this is something that's deteriorating the health of our youth. How can we correct that? You look at, you go into the hospital, you see vending machines. You go into schools, you see vending machines. Is anything in there healthy? No. They're full of junk and sugary drinks. And this one encourages our youth, once again, in the hospital to get something unhealthy. But we can change that. And that's our goal with the Hope Foundation, is to help our listeners and also our communities live a better and safer and healthier lifestyle. And you might say, this is Mental Health Month. So what does that have to do with obesity? Well, think about it like this. A lot of our youth, when they're eating, when they're obese, they lose self-esteem because ones are talking about them and things like that. So that can causes a mental effect on them. So they're affected more than you think. You think that they're just unhealthy physically, but they're unhealthy mentally also. So always take a look and see that, there's something else, underlying condition that's causing their condition of being obese. And sometimes it's not just unhealthy eating. It could be stress in the household. It could be problems at school, peer pressure, things like that. So we should always have a listening ear for our youth. And not only do we try to feed them the right foods, make sure they get the right nutritional diet, but also have a listening ear. Because right now we're going through COVID. And COVID is playing a big part on our youth. They're locked up, they're in the house, they can't do anything. What do they turn to? Eating. They get tired of playing games, so eat more. They don't go outside for any activity. So their health is constantly on a decline. And when COVID and all the restrictions are finally lifted, what shape will they be in? They'll be in the hospital, not from COVID, but from being sick and unhealthy because of their diet and lack of exercise. So our goal is to help all of our youth live a safe and healthy lifestyle. Because remember this, without safe and healthy youth, there is no tomorrow. I'll turn it over to Chef Cheryl, and she's going to talk to you about nutrition.
Oh, thank you. Thank you, Kevin. I am, oh goodness, sorry, I am sharing my screen. Here we go. Stop share. I'm screen sharing. All right, share screen. Okay, slideshow 2. All righty, can everybody see my screen, I hope? Hello, can everybody see my screen?
I can see
No,
you.
no, we can't.
You can't?
No.
Okay, so let me get back. Let me get back. Okay, share screen. Screen. Okay, share. Slideshow. Can you all see my screen now?
Yes.
Yes.
Yes. Okay. Thank you. Thank you. And Kevin, thank you so much for that. We weren't able to coordinate on what it is that we were going to talk about, but I'm going to talk about positive youth development. I'm going to stay on this track because it's just very important. May is Mental Health Awareness Month, and with everything that's going on in this world, I really think that we need to talk about all the aspects. Later on in the presentation, we'll definitely talk about food, but I want to talk about positive youth development. And one of the things that I like to do is I like to go to the source. I like to see what the government is talking about. So this information that I got is from the U.S. Department of Health and Human Services as a source of information. But we all have information, we all have knowledge. So we're going to speak on these things, but we're also going to talk about how it affects us. We can talk about how it affects us. The government can say one thing, but how does it affect us? Okay. So, what we have, and this is interesting because this is exactly what Kevin was talking about, where, we have adverse child experiences and, and Regina also, all these things play into how we grow up. And if these situations that we have as children, domestic violence, substance abuse, someone going to prison, poverty, these all affect children. Okay, even from the start, they all affect children and their emotional development. And so here is definitely, as we see a tree growing, we also see the roots. Okay, what are the roots of adverse childhood experiences? Lack of opportunity, what we see, what we grew up seeing is what shapes our world. So as a child, and what we see is definitely going to impact how we are, growing up. Okay, so this is childhood experiences. Okay, so we have adverse childhood experiences, and we also have positive childhood experiences. Excuse me. Sorry, let me go back. Oh goodness, sorry. Okay, so adverse childhood experiences are behaviors that we have experienced, that we have experienced. So positive childhood experiences are the opposite. Okay, what did we do as a child that we grew up that was positive, that we can remember, that was good for us, that is done on a consistent basis to where we can say, oh, wow, we're going to be great citizens because we had examples of that coming together. And this is something that I read that was really telling. And it talked about earlier this year, we had some people come to the Capitol of the United States and do some pretty ugly things, and whether they got in trouble for it or not, they were pretty ugly. And I don't think I would even contemplate doing something like that, taking a plane, going to my nation's capital and going in there and just messing up the place. I would not think of that. Okay. Who would think of something like that? somebody who probably had some experiences that says, oh, we can go do this. We can go take this back because it's ours. This is what we want to do. So these are some of the examples of adverse child experiences that culminate into adulthood, into what we have, the actions that we have. Okay. So I really want us to think about this subject as opposed to how we are now. How did we get here? How do we have these attitudes and these habits that we have growing up? And that is from having an adverse child experience versus a positive childhood experience. Okay, so what we are doing here at the Hope Foundation is using an intentional social approach, okay? Because positive youth development is really just viewed as making sure that your kids get, positive experiences growing up. We understand that, in our community, we don't have a lot of resources. But resources, sometimes if we don't necessarily have resources, we have a good attitude about it. I grew up in a home where there was a lot of family, a lot of love. I had a lot of cousins and everything. But my home life wasn't all that great. There was dysfunction there. There were aces that were present. So what balanced it with me was knowing that I was going to see my family and I was going to get those positive experiences based on going home and it not being so fun. So even as a child, mental health is, we're subjected to it in this situation right here. So positive childhood experiences promotes the ideas that adults can make significant and positive differences in young people's lives. So with the Hope Foundation and what we have youth mentoring, we have health and wellness as this webinar that we're putting on right now is a way to prepare ourselves to be better examples for the youth. Okay, so physical and mental health, of course, that's what we know with youth. We have to keep them safe. We have to keep them in positive experiences. Okay, now there's a growing evidence that adding positive youth development principles in youth serving programs can have positive effects across multiple parts of young people's lives, okay, including their physical and mental health, relationships, and academics. Okay, this approach has been particularly effective when working with vulnerable and underserved adolescents, including those that have been maltreated and those who are part of racial, ethnic, and minority groups. So again, with my life in coming up, and I saw how different it was to not have such a good home life, but having a good family life as opposed to being around my family and cousins and being that. I made it a point when I was coming up to say that, hey, you know what? If I get married and I have kids, I'm going to make sure I give them good, positive experiences. I just made it a mental note as I was a young child that I wanted to do that because I wasn't really happy with my home situation. I saw other children and how they had 2-parent homes. And it was just something that I, as a small child, said, this is what I want. So I believe in telling my story because it's what helps you see where I'm coming from. So I really, pressed that with children. And, here this picture here is of an environmental charter middle school that I put my child in, where they learned to do everything with the environment. They went camping, they learned how to quilt, they learned how to make brush fires. It was a nice environment, learning environment, to where it was very, very positive, very positive. And so again, positive relationships and experiences matter. I put these pictures here because there were positive experiences that I exposed my children to. This top picture is my uncle. He turned 100. Okay, and at the time that he did, President Obama was in office, and he sent him a letter, and it was wonderful. But I was able to expose my children to, oh gosh, look, your uncle turned 100 years old. Look at all the family members. This is a wonderful experience. This is something that you should be proud of. Okay. The second picture that I have here is of a charter school. My children have been in charter school, you know, from start. But this was a charter school that was started by an African American guy who wanted to have teach finance to the children, you know, because in African American communities, we're not taught that. So the curriculum was based on finance, was based on understanding student loans, understanding loan debt. So, you know, my son, when he graduated, he had those tools, as opposed to, you know, not having understanding what loans are or credit cards, or going off to college and getting into a lot of student debt. So, you know, our youth, it's so critical that we have good experiences for them. We need to make it a point. You know, children, we're stewards. We're stewards. We're just here for them a short amount of time, because we're all grown now. We all have adult experiences, and we can go back and say, gosh, I did that when I was a kid. Or gosh, I did that, you know, when I was younger. I can really hold on to those experiences as we go through, you know, as we go through whatever it is they're going through. They strengthen us going forward. Family is so important. Mentoring is so important. Having parents that, like Regina said, having a listening ear, as Kevin said, having a listening ear, being there for each other. Because again, the youth are our future. If we don't capture them now, if we don't give them the love and the protection and the motivation and the development that they have, these are the people that are going to be making decisions for us. So I really like to keep that in mind when we're dealing with youth, because, you know, these are the people that are going to look up to us. You never know what, you know, when you're mentoring a youth or something, that you're going to see them later on in life and they go, hey, I remember you, you helped me do that, you know, and that's a rewarding, very rewarding feeling. So, you know, this is my youth segment. And of course, you know, again, youth are so important, and mental health is just critical for them. They need positive need positive reinforcement. So I'm here for that, and I'm just very happy to be part of the Hope Foundation, where we do make this happen for them. Thank you.
Thank you, Cheryl. Thank you. We are YouTube burn you now, right?
Yes.
Engage.
Thank you. Are there any, we have any, does anybody have any questions? You know, this is a very interesting subject. We've had some wonderful testimonies and wonderful information. Does anybody have any questions? Or let me look in the chat.
Okay.
Okay, we didn't have any questions. Okay, so.
Yes, everybody feel free. Anyone who's out there who is from my page, feel free to ask any questions. It's your opportunity to know what, you know, what we do and how we do it, and how you can participate, or, you know, what we can do to help you and your community as well.
I have a question.
Yes, please.
Okay, this question is for Regina. I was out one day and I seen a young lady that was hiding behind, it was like a laundromat, but it was something there. And she was hiding behind it. And but she was on she had her phone, she was on the phone. So she waited till people passed by, and she came out, and she only had a towel wrapped around her. And she asked me, she said, ma'am, she said, my clothes are I'm washing my clothes. And is there any way that you could help me, give me some money so I could buy me some food? So I said yes, and I gave her some money. And I also gave her my business card to get, you know, if she needed further help, you know, to try to get her some help.
Right.
But my question to you is, how best is it to, approach someone on the street? Some people say it's dangerous. What do you say?
Well, actually, I was fortunate enough to, when I started outreaching in 2004 with Cherokee Morrison, which was my mentor. He was a Vietnam vet, and he had came back because he was ill, because he was diagnosed with schizophrenia. And he was what you call a recoverer. So he recovered the dead bodies. And he was just 16 when he went in. So when we're speaking about children, and could you imagine that a government would send a child over it? Okay, that's just the point. But what he did show me was how to approach uh, outreach and engagement. Outreach and engagement, it can be very dangerous for you because I had, walked with him, and so many people had, they knew him because when he came home, he went to the riverbed, and the riverbed is where everybody lives. You see it on TV, you see the people, in those canals and things like that. And Long Beach has the LA River that runs through it, and that was the main river that they all went to. And he was there doing, drugs and getting high until one day he just got up and he said he was tired, and he went and he got in a transitional home. And the lady made him a manager, and then he got the job at MHA LA. And this is like 1987. And then he began doing the outreach from a bicycle with sack lunches. So he had a bike. He started, and when MHA started, they had very, very meager beginnings. And when they decided to have a homeless program, which they called HAP, which is Homeless Assistance Program, they started off small. He went out on a bike with sack lunches, and he started taking it to them. And over the period of years, by the time I got to MHA in 2004, the whole city knew him. They knew him as far as San Pedro, Wilmington. And then when I walked with them, I became his secretary in better behalf. For me, it's very easy because I'm in tune with them. Over the period of time, you become, it's kind of like a kindred spirit kind of thing. It's like, I have the capability to, I can be driving by. So, we would get in, he went from a bike. By the time I got there, he had the caravan, and we called it the White Buffalo. And we get in that White Buffalo and we go out there and go on those riverbeds and those underpasses, and we take up sack lunches and offer them to come in because they would see him, they were good. But when they would see me, they were good. It's kind of like, when it comes like we're saying about, we're going to be working with, police. You really have to be a compassionate person. It's kind of like babies. You know how children can tell when someone doesn't like them. Well, that's the same thing with them. Most majority of homeless people out there, they don't want to bother anybody. They basically, and like you said, the caller had asked, you said you found that lady underneath something hiding. Most of them are hidden. How I became to distinguish the difference between a hustler and a real true homeless person is because a real true homeless person you don't see them at the gas station, you don't see them panhandling or nothing like that. If you see them anywhere, you see them with some cans or candy or something like that. For me, it's very easy. Or have someone go out, during every year that we do the homeless count, they have all these students and all these professionals from all over the world come right here, go right to Long Beach, and we go off in teams. And what I found from that, people still didn't want to deal with them. I didn't care. It didn't matter what they gave them. And this is one thing too that we have to consider. Sometimes, when the students come, they say, well, we're going to give them a $5 gift, card to McDonald's, or we're going to give them some Starbucks coffee. And that wasn't going to get them to give their information up. And what they learned from walking with me is that they'll give me their information without me, offering them any type of trinkets. You can't look at them like they're like seals and you're throwing fish at them. You can't. Mm-hmm. You have to be a compassionate person, and they have to be able to see through you. Because I suffer from mental illness, and I can tell when I sit down with a therapist or a psychiatrist, I can tell if that person's not going to be right for me. I don't trust. It's an issue with trust. And once you start to go out and you engage with them, and they see that you have some hope and you care, you really genuinely care, and you're not there just to fill a budget or fill a space or make a number or count them as a number. They're more susceptible to want to take something from you. Some people won't take something from you. We had a lot. My mentor, he outreached to a lady for 9 years before she came in and before she got housed. 9 years. She was blind and she was 9 years. So it just has to be the person and your purpose and what you want to do to help them. They got to feel you. That's basically.
Great. Thank you
Thank
so
you.
much, Regina. Thank you so much, Regina. That was good. That helped me, you know, because I've always wanted to approach someone. Sometimes I'm approached, but I do understand. Okay. Does anyone have any more questions? Does anyone have any more questions? This is really interesting information here. And
Oh, I can
really
check.
encouraging you in the chat, Regina. Well said. Outreach and engagement is vital for youth today. And I think that the programs we have with the Youth Foundation, awesome.
Thank you so much. Thank you, Roxanne.
Great. So we're going to move on to announcements. What are we going on to? We are here for spotlights. We're for spotlights right now. Yes.
Okay, for spotlights, I do believe that's going to be me, you, and Kevin, actually.
No, it is, I believe it's Sharonda.
Oh, Sharonda.
Sharonda.
Okay. Hello. How you guys doing?
Sharonda, hello.
Sharonda.
Hello. Hi. My name is Sharonda. I'm going to talk about bipolar depression. Okay, I have a business, Bipolar Depression for Disabled for Special Needs. Okay, a little bit about bipolar depression. It's a mental illness for, bipolar people, as far as depression, as far as mood swings. They have mood swings daily, sometimes weekly, So with that, it's like a physical thing. So sometimes they have different things that they can't be able to do because of their condition, as far as being disabled. So one thing I do learn about dealing with bipolar depression is when I was working with them for about a year. I had an encounter with a client. He was at the laundry room washing, and he stripped his clothes all the way off. And I turned around and looked and was like, okay, my other co-worker was there and she was looking at him. So she was afraid, I wasn't. So I knew how to approach him. Like Regina just was saying, that dealing with mental ill people, you have to know how to approach them. So I politely walked up to him and I asked him, do he need any pants on? And he was being aggressive as usual, because they don't know how you're gonna come at them because they're afraid. So the tone of your voice, it really impacts them the way you approach them. So by me being a woman, and I was calm, and I was letting him know, I'm not here to fuss at you. I'm not here to attack you, but I'm just letting you know that you can't stand right here with your underwears on without putting some proper pants on. So when I approached him like that, that's when he explained to me that he was trying to wash his clothes. So that's when I told him, I'll be right back. I'm going to go there and get you some pants, and then I'm approach you and, give them to you. So as I received the pants to him, he felt trust. He felt like he could connect with me. So that's what made him feel calm. So like she said, they practically like kids. So if you have any kids that have a behavior problem or have a temper, you know how to approach these people. So that's what I was dealing with him. I was aware of his condition, his mental condition. He had an issue with his thinking and his mood swings, because like I said, some days it happens daily, sometimes it happens longer, it happens weekly. It depends on their mood swings. And
Sharonda.
Yes.
Sharonda, we thank you so much. We only have about a minute. We're gonna keep moving. Thank you so much though.
Thank
Kevin.
you.
Kevin.
Hello, everyone. Once again, Kevin Wilkes, founder, CEO, and author of WLL Enterprises, Inc. Our goal is to help our youth live a safe and healthy lifestyle. And we do that through our 9 children's books. We have 9 children's books, 7 on healthy eating, 1 on keeping them safe that teaches them about how to stay safe during an earthquake and active shooting. And our latest book that we have on COVID, Cell Block 19. It gives our youth a better perspective on what's going on with COVID and how they can deal with that and show that there is a brighter side to what's going on now. Thank you, Cheryl.
Thank you. Okay, next we have Regina.
Hi, well, as everyone knows, I'm the president of Omni, also too, Genius Group Theory, but I am a recent Jaffa consultant. And if anyone's aware of Jaffa is skincare products as well as fragrances. Here is our men's, we're gonna be raffling this off today. This is shaving cream. They have everything for the skin's needs. When we're talking about getting healthy, we need healthy skins. Jaffa has been around for years, and the royal almond jelly works very well on our skin on all different shades. It's not just for one race of people, it's for everyone. So I would, say that if you guys wanna get some Jaffa, I'm available. Thank you.
Thank you, Regina. We'll have a raffle at the end of the program. That's great. I could use that aftershave for somebody I know. Thank you. Next person. Who's okay?
We have, actually that's on me. We have, who's coming up is sickle cell. Segment number 3 is sickle cell, and we're gonna be joined by Nancy Renee.
Hey, good afternoon, everyone. Thank you so much, Chef Cheryl. This has been a great program. I'm so happy to be on the team with all of you. We're going to be talking a little bit about sickle cell disease, sickle cell in the Black community. And for some reason, my screen has gone off. Let me go over here. I did the share screen, but I can't get it to come up.
Nancy, double click on your share screen, and then you should see where you should be able to share your PowerPoint. And click on the PowerPoint, select the PowerPoint.
I've been doing that. Click on the PowerPoint I just did. Let me do it this way. Aha. If I do, there you go. Wonderful. Thank you.
There you go.
Okay. I began a little bit about me. I became interested in sickle cell disease with the birth of my grandson, Joseph, who's now 18 years old. So it tells you how long I've been interested and concerned about sickle cell. He had a stroke when he was a baby, 9 months old, and he had a stroke. And so that let me know, how serious it was, what could actually happen. And that just began my journey on sickle cell. So now I'm going to give you, if I can get it to change, aha. Well, we'll just talk, we've mentioned this before, but just to make it clear, that sickle cell is a genetic disorder, and that the red blood cells, the red blood cells are normally round. They flow through your system pretty well. And but with sickle cell disease, they clump and shred. And so it causes anemia because they no longer carry oxygen and they block the flow of blood to various organs in the body. So the main symptoms are organ damage and fatigue and so on. Most people, I say most people, were screened for sickle cell at birth. If you are younger than about 40, because 40 years ago, they did not do sickle cell screening. So my daughter, who's older than 40, we didn't know that she carried the sickle cell trait. two different things here, sickle cell trait, which means you are a carrier of the disease, but generally you don't have symptoms, or sickle cell disease, which is where you get the sickle cell crisis and the fatigue and all of that. So I talk a little bit about getting tested. You'll need to ask your doctor about testing. If you have sickle cell in your family, there might be a chance that you have sickle cell trait. And to me personally, if you have a family member who's in their childbearing years, they might want to be screened. They might want to know whether sickle cell could be an issue for them. And if both parents have the trait, it's a 1 in 4 chance that their child could have sickle cell disease. My daughter and her husband both have trait. My grandson has sickle cell. His sister does not. She has trait as well. So, it's one of those 1 in 4 things, and you at least want to know what your chances are. Okay. Stem cells, you hear about them. Stem cells are being researched for as a cure for sickle cell disease. You might see some ads about stem cells and stem cell cures and so forth. That's not happening right now. It's being researched, but it is not happening for any disease. What happens in sickle cell is that the bone marrow is removed from the patient and doctors manipulate it so that the gene that causes the blood to sickle is no longer present. This kind of gene therapy hasn't been proven yet because often what happens, they manipulate the bone marrow, they put it back in the patient and it doesn't engraft, it fails to grow. So CIRM is our California Institute for Regenerative Medicine, and they have 3 trials right now for sickle cell disease. And all of them have a community member representing the concerns of the patient and the families. I'm a community member on 2 of the trials. One of my good friends is a community member on the 3rd trial. So it's not a case of people just doing this research without any input from the community. I have the grandson with sickle cell. She has a daughter with sickle cell disease. So a lot more research is needed. And but it's the scientists really seem to like it. They really seem to get the idea that because there's just one letter in the DNA, that whole long chain of letters, there's only one letter that's out of place that causes sickle cell. So they're thinking this is something that can be changed. What about other medications? Well, one of them, hydroxyurea. It's been known for more than 20 years. It encourages fetal hemoglobin. When babies are born, they have a different kind of red blood cell that's called fetal hemoglobin. And that doesn't sickle. That's why babies don't have a sickle cell crisis until they're at least 6 months old. Usually it's more like 9 months. But some doctors and their patients are reluctant to use it since it was first used as a chemotherapeutic. But the research has shown that it does not cause cancer and that it is safe. But like so many things, we need more education so that doctors understand it better, as well as patients understanding it, so that they can take advantage of something that is really shown to be a benefit. Right now, only 46% of patients are taking this life-extending drug. It doesn't cure sickle cell, but it makes people less likely to have a sickle cell crisis. My grandson, who's now 18, has only had 1 or 2 crises in that 18 years, and never so bad that he had to be hospitalized for it. So I'm very thankful that his doctors, he was at Kaiser, did a good job of educating us. We did a good job of educating ourselves so that he could take advantage of that therapy that is well known. There's another therapy that is out there called Endari. It's been approved by the FDA. It helps with inflammation, but again, patients are reluctant to use it. And again, we just need more education so that people can understand the research and understand the research approval process so that they have a chance to ask whatever questions they need to in order to overcome any fears that they might have. But what's really wrong? Sickle cell, the average lifespan of people with sickle cell disease is only about 45 years. Only about 45 years. But of the states that have been surveyed, and not all states have, obviously, some states have very few people with sickle cell, but California, Georgia, Alabama, District of Columbia, those are places where you have more sickle cell disease. But even so, even when interventions are known, the well-established delivery of appropriate and comprehensive care is uneven. In California, we have about 6,000 people with sickle cell disease. We've only found about 8 hematologists who care for people with sickle cell disease. Well, obviously, 8 doctors can't care for 6,000 people. There's all kinds of things that's wrong with that. So there are some people who don't have a primary care physician at all. They simply go to the emergency room when they have a sickle cell crisis. And trust me, the doctors in the emergency room do not know what to do, and they are not held accountable for racist, unprofessional treatment. Looking at them and saying, you're just here for drugs. I know you just want drugs. Or patients, women getting dressed up to go to the emergency room because they hope that maybe if they look a little bit more professional, they look a little bit better, that they'll get treated better. Not necessarily. I've been in the emergency room, as many of you know. Your board member, Cecil McLean's daughter, had sickle cell disease. And I went with her to the emergency room any number of times. And basic things like hydration, and this doesn't mean just drinking water, but starting an IV with water so that it kind of lubricates the blood, if you will, and helps all of those misshapen blood cells slide through a little bit better and cuts down on inflammation. Doctors were so busy questioning her because she wanted the same pain medication that she'd gotten before, that they weren't doing the basic things. She was going to UCLA. She'd been at UCLA a number of times. She would say things like, check my chart. I got this particular medication the last time I came. And they refused to do it. Just unbelievable, unbelievable. And this last statement comes from a nationwide report that says sickle cell disease is largely a disease of African Americans, so it exists in the context of racial discrimination and the effects of poverty. So you get this. This is not a new story. This is, a lot of the things that we're fighting. So what can we do? We have to grow our political will so that, for instance, mortality rates for sickle cell in California are not the highest in the state survey. ER use, and this came from a state data collection project, ER use is much higher for children on public insurance, pointing to a lack of standard care. It seems to me that if you are going to the emergency room a lot, it's because you are not regularly going to a doctor who knows enough about sickle cell to prescribe the kind of medications that cut back on the crisis. The crisis is not a natural occurrence of sickle cell disease. It's what happens without good care. What else can we do? Join webinars and health fairs. And we're going to have several things that are happening in the coming months. And these issues represent what's happening for patients of color with all kinds of chronic diseases. And in fact, I'll tell you about one of them, and it's really just terrible. But let me go through this, that we need more programs for training of healthcare professionals, increasing the payments for doctors, programs that train doctors and nurses on recognizing and overcoming racism in healthcare. But sickle cell has been in the news, and there has been an excellent article in the New York Times. It was just a week ago. It was the story of 3 sisters. And these 3 sisters all have sickle cell disease. As I told you, it's an inherited disease. So with each pregnancy, both parents carry the sickle cell trait. With each pregnancy, they had a child with sickle cell disease. The family suffered needlessly from stroke. All 3 of these girls, I think they're all teenagers now, had stroke, even though there are well-established tests that were not used for them. Nobody sent them. It's called transcranial Doppler. It's to measure how fast the blood is running through your brain and how it, whether or not it's being blocked by anything. And so this family suffered needlessly. These children who were born, at least they started with just sickle cell, now they have stroke. My grandson was lucky, if you can say having a stroke was lucky. He's lucky in that his right side is a little bit weak, but it really didn't seem to affect his thinking because he's doing well, graduated from high school, took a couple of AP classes and so on. And I will tell you that being a boy kind of takes some of the issues off of sickle cell, because he was going to go out there and play basketball. So what that he couldn't shoot very well with his right hand? So what that he couldn't block very well? So what that he was running with a limp? He still went out there every morning to his local park to play basketball. Now, he was in the hospital when he had his stroke. The parents were told that he was so young that they didn't have a test to identify the transcranial Doppler that might have told doctors that he was going to have a stroke. I don't know whether or not that's true. The doctors are not very good, especially when you think about the liability they would have had if they had said, oh yeah, you're right, we should have done this test on him, and we didn't. And so now he has a lifetime of weakness on his right side, and it's our fault. They're not going to say that. So that, but it happens all the time.
Wow.
Let me do this. Yeah. Just one other thing, and we talked about CIRM, that they're doing regenerative medicine and stem cell research. The doctor that is doing the research on sickle cell disease is the same doctor who's doing research on SCID, severe combined immune deficiency. Remember the old movie about the boy in the bubble and with John Travolta? Well, that's what severe combined immune deficiency is. He had a research program of about 50 babies in the program. He was able to cure them so that they now have regular immune systems in 48 out of the 50. Well, the company, the outside company that was licensed to handle the actual medication, they were unwilling to proceed with the research because it's too expensive. So other families who know that this cure is a good possibility don't have an opportunity to do it because this company, Orchard, was unwilling to proceed with the research. This is exactly what could happen to sickle cell. It could be that this very same doctor, Dr. Cohn at UCLA, is doing research on sickle cell. He could come up with something that allows the bone marrow transplant to be done in a positive way that would actually cure people of sickle cell disease. And then a company that is licensed to provide the cure would just say, no, I'm sorry, it's too expensive. That's just appalling. It's unconscionable, but we're built on making a profit. So that's what's going on. I contacted him. This was a story that was in the LA Times this week. I'm so glad these things are being reported on. So at least people know that it is making a difference and people know what will happen. He told me to be patient. I think there's something in the works that we don't know about just yet, but I'm still very concerned that we have research and then See, there aren't that many people with sickle cell. It seems like a lot to me, about 100,000 in the United States, but that doesn't compare at all with the amount of people with heart attack and cancer and stroke and that kind of thing. So of course, companies want to develop medications where they can sell 1 million doses of it. And quite frankly, where you keep needing the dose month after month after month, you got to go back to the drugstore and get your 30-day supply of more medication. They can make a lot of money doing that. If you do something where people are suddenly cured, oops, where's their market? How are they going to make money? And that is part of what's going on. So it's called Stay Tuned. It's something that I would hope it gets to a certain point, we'll be able to talk to our federal lawmakers about what needs to happen so that all of this research is not done in vain, whether it's for us with sickle cell, whether it's these children with bubble baby disease, or whether it's anything else that's going on. So that's where we are. Lots of good things that are coming up. So here's the honest truth. This is my thing. And you'll find out I can be kind of a radical. Just as there are police who are not held accountable for their actions, it's the same for doctors. Doctors cover for each other and are often unwilling to testify in malpractice cases. Doctors and nurses often look the other way when a patient is being treated with racial bias. It took years to go from Emmett Till and Rodney King to George Floyd. Let's hope our sickle cell community doesn't continue to suffer needlessly. So that's my update on sickle cell. If we have time, I can take any questions, or if not, I'll leave my address up there. I'm happy for you to send them to me or put them in the chat. It's been a pleasure talking with you. Thank you for allowing me to be part of this program.
Thank you, Nancy. Thank you so much. I saw that Isabel had her hand raised. Isabel, did you have a question?
Yes, I just want to thank Nancy, and we have to keep raising the flag on this and bringing it forward, because so many people don't know about this, and racial inequality has always been. But I was listening to her saying that in some states it's higher than others, and I was listening to a doctor that talks about the minerals in our ground, in our groundwater, in our soil for our fruits and vegetables and everything, that there are different quality of minerals in different states. So I'm wondering if they have investigated if they're deficient in a particular mineral.
You know, if they have, I'm not aware of that research. To me, it's more about the sickle cell centers. It's more about hospitals and universities and who's leading those. There are some great doctors in Atlanta, and Atlanta has much lower rates than we do in California. In California, we don't have, of the 6 to 8 hematologists, I wouldn't call them leading hematologists. And in fact, the social workers at LA Children's Hospital have a very hard time with their children who age out of the system because now they're 18 or 19 and have to go into adult care. They can't find anybody to refer these children to. And one doctor, Dr. Cage Johnson, who was at LA County USC, he retired 8 years ago. They still haven't filled his position. So that's where we are.
Priorities.
Yeah.
I have a question, Nancy. You said that there was some medication that was available, but they're not using it. Why is it? Is it a fear of the medication? Is there something in RE or something that you had said?
Yeah, I think there are several things. I think the patients may fear, but usually, you know, if my doctor is going to prescribe something for me and I'm unsure about it, I'll ask questions and the doctor will be knowledgeable. I think what happens is these doctors are not very knowledgeable, or it's because so many people don't have a regular, I cannot imagine having a chronic illness and you don't have access to a specialist to help you through that.
Right, right. Yeah, that can be very frustrating, to
Yeah.
say the least, to have something and not have a regular doctor. Wow.
Right.
Yes. Thank you so much. Thank you so much.
My pleasure.
Okay, so up next we have, I don't know if I am to be introducing this person, but I will introduce her anyhow. Maria, Miss Isabel is here to talk about hydration and nutrition. She is awesome, awesome. We know that we can't live without water. And if you don't have enough water in your body, you can't think straight. So it's all tied to mental illness and hydration. So Miss Isabel, thank you so much for being here, and we look forward to everything that you have to say.
Yes, thank you for having me. My name is Maria Isabel Rutledge, and I'm a proud member of the LA South Chamber and part of the Hope Foundation, and I'm a community ambassador because this chamber is unlike any other chamber. At age 68, which I am right now, I'm grateful for the regaining of my health. When I was 55, I was extremely sick. And I am here to serve the community and to teach what I learned on my journey to health. So I bid everybody a good evening and thank you for your interest in improving your health. And knowledge is power only when it is put into action. So I hope that all this information gets put into action and we can see a difference. When we practice a healthy lifestyle, we are an example to our family and friends. I'm here to talk about hydration, acidic or alkaline body, and health. On our way, the only way that we can come to this earth, to this world, is as humans, we develop in a bag of alkaline water. And the quality of the water matters. For 9 months, the baby takes alkaline minerals from the mother and causes the mother to have morning sickness. But if she consumes alkaline foods and alkaline liquids, she can avoid morning sickness altogether. And the baby will be healthier and stronger and will more than likely not ever have jaundice. Jaundice means that your liver is not fully developed because it wasn't alkaline enough. We are born 75% to 85% alkaline water. And that means that we smell sweet and delicious. As time passes, we lose hydration and die at about 50% acidity. An acidic body equals pain, inflammation, and degeneration. The average adult is at 60% hydration. And our choice of foods and drink create either a healthy alkaline body or an acidic sick body with pain and inflammation. We can age slowly and healthy or quickly and sick. It's our choice. Dr. Otto Warburg, a Nobel Prize winner in 1931, discovered the cause and prevention of cancer. Could we have Dr. Warburg's slide, please?
Thank you.
And it is, thank you. And it is all about our constant balancing act of our bodies between alkalinity and acidity. Cancer today, 90 years later, is the second cause of death in the United States, even with Dr. Warburg's discovery. Our health system is failing. We must take control of our family's health. My health journey started 13 years ago. In 2008, when I was about 300 pounds and very sick, when I learned that I needed to run back to alkalinity. I was so acidic. I was really almost out that door. Luckily, our Creator creates our bodies to heal itself when we give it the correct fuel: alkaline foods and alkaline water. Faucet water is full of chemicals and traces of medication, and it is very acidic. Bottled water has no minerals, and it is void of any nutrients. Quality water is molecular hydrogen-rich water, the ultimate antioxidant, and it is alkaline, full of vital minerals, calcium, magnesium, potassium, and more, giving us strong bone density, nails and teeth, and hydrated hair and skin. Enhances immune system function, assists in the prevention of disease and illness, immediately hydrates 6 times faster than regular water, increases energy and vitality, enhances circulation. Please give me a call at 213-447-5699. If you have any questions, or if you would like to have free Kangen water for 2 weeks, give it a try. You will see your world change. Thank you.
Thank you, Isabel. That was awesome. You know, water is such an important factor of our lives. Someone had asked a question, and they asked which alkaline water is best. I mean, I know you have one, but is there any particular one on the market that you might suggest that someone could do?
Well, anything sold in the market is alkaline by adding chemicals. You can actually make any bottled water appear alkaline by putting a little bit of baking soda in it. And that is what they do in the pools, and that's what they do at the Hyperion plants. And they add lots of other chemicals because they have to kill bacteria and everything else at the Hyperion plant. But bottled water has no minerals at all. So it does not give your body what it needs. So when you drink bottled water, since it is reverse osmosis and all of the minerals are taken out, the body is unable to use that water. So it goes to your bones and takes minerals, calcium, magnesium, and makes the water whereby it can use it for your body. So slowly but surely, when you drink bottled water, it takes minerals out of your system instead of giving it any. So the alkaline water that you find in the stores is chemically altered, just like the water that comes out of your faucet. Your faucet water by law has to be 7.0. That's a neutral. That's a neutral. When you saw the picture of the baby and the old lady, the center, which is green, is neutral. And the faucet water has to be neutral legally so that it doesn't rust the pipes in the city system. They're not worried about your pipes. So it is important to buy, it's just important for you to contact me and I'll give you more information on a better choice.
Okay, someone else had a question in the chat. They asked, do you recommend alkaline drops to make water more alkaline?
Alkaline drops are available and they do make it more alkaline, but again, it's still chemical. And if you're pregnant, you should not use those drops because it negatively affects the baby and the mommy.
All right, thank you for that information. That's real important to not use alkaline drops when you're pregnant. These little bits of information I'm definitely taking note of so I can pass that on to the next person. Okay, well, we're having spotlights because we have an awesome chamber and we're going to highlight one of our chamber members here. Our first person up to be highlighted is Marianne. Marianne, are you with us?
Yes, I'm here.
Yes, please.
Hi guys, my name is Marianne Ping. I'm recovering drug addict. I have a really long mental health story. I grew up with a chronic illness, and that made my mental health worse. And so for the past year, I have been healing myself, my gut-brain axis. And right now the spotlight is for what's helped me. I have to offer the first ever gut-brain axis protocol. It is the first ever supplementation system that targets our gut-brain axis directly to bring our whole body back into balance. When it's my turn to speak, I will talk a little bit more about gut health. In addition to that, I will be raffling off a product called Energy Plus. It's an all-natural energy drink. There's no caffeine, no stimulants in it. It's made from pomegranate, matcha leaf, and one other ingredient I can't remember. But it is all natural and really good for you. It provides not only physical energy, but mental energy and mental focus. So on to the next person is,
Okay.
yeah.
All righty. Well, we'll look forward to you saying more about it in your presentation. Okay, I'm the next person. My name is Chef Cheryl Tate, and I am a personal chef. I am the owner of Nurturing Chefs Personal Chef Services. I am a health and wellness consultant. I believe in healing the body through food. As a personal chef, I have worked with many clients, some with diet restrictions, some with allergies, and just medications, certain protocols. And what I have experienced is over a period of time, if one eats correctly and one follows the protocols, we can come off the medications. We can not be as sick as we were. I had a client one time who could not have vitamin K. So that meant she couldn't have any leafy green vegetables, which to me was a challenge because she needed healthy green vegetables. So we had to find other ways for her to get the minimum amount of the nutrient and still be well. Food will heal you, just like hydration can heal you, and we have a gut-brain axis. We have technology that where we're finding out, well, gosh, there's other ways that we can be well aside from just eating and thinking. We have a connection. But and I just wanted to plug Marianne because her product is awesome. And again, I use that when I talk about health and wellness with my clients. Look, here's a product that you could use that can help you along with the meals that I am preparing for you. So as a personal chef, I am here to consult. I'm definitely here for for catering, but my main course is just to have a healthier America, a healthy Los Angeles. That is what I enjoy, and that is what I'm here for, and that is why I am a member of this wonderful chamber. So I thank you so much. And our next person presenting is beautiful Opa. Opa, where are you?
I'm right here. How you doing?
Yeah.
Good afternoon, everyone. This is so awesome. I tell you, it's just so much needed. My name is Oprah Price, and I am a member of the LA South Chamber. I am on the board with the chamber as well. The name of my business is Insurance Solutions. I am a broker, and I tell you, I got involved in this business. It's been a little over 35 years now that I've been in this business. But I happened to get into this business because I lost my mom at a very early age.
Mm.
And I felt like at that point that, people need to know what their options are. People need to know about, it was 10 of us and we knew nothing about death. My mother was the first one to pass in our family.
Mm.
And it was just devastating to all of us. So I found, a way to get into the business so I could share with people what their options were, what they needed to know in event of death, and how they could protect themselves and how they could prevent, because as it is, you're grieving, you're hurting, and you have to come up with all this money to, for a burial, final expenses and all of that. And we knew nothing about that. And so I wanted to share to my community. I started out knocking on doors, telling people about, asking them, are you protected? And that's how I started my business. I truly believe, because I am a broker, I feel like people have different needs, different situations. This is not a one size fit all situation. Everyone's needs are different. And that's why I became a broker, because everyone is different. And I feel like I needed to have a program to meet their needs, their budget, and their particular situation. It is an honor to be here today, and we'll talk a little bit more about that in my next session. Thank you very much.
Thank you, Opa. We really appreciate it. And, insurance, that is very critical in our day and age to have some sort of coverage. It's just so important that, we have these things in place. So coming up next is our wonderful Mary Ann Ping, who's going to talk about gut health. She's got some really great information, some really great products, and we're happy to have her as a part of our Hope Foundation. Thank you, Mary Ann. You there? Hello?
She's muted.
Okay. Mary Ann, let's unmute you.
Oh, I thought I unmuted myself, sorry.
That's okay.
So I'm gonna talk about gut health and the gut-brain axis, a little bit backstory. I had life-saving surgery when I was 21 days old due to a congenital issue. And because of that, I grew up basically on multiple rounds of antibiotics, probably more than 100 in my lifetime. And I took corticosteroids from toddler to high school. So those pharmaceuticals really, really impacted my gut health in a negative way, because as we all know, one round of antibiotics can destroy your gut health for 2 to 4 years. And because of that, my mental health deteriorated extremely to where I was addicted to meth for 10 years. I am now 1 year and 5 months clean from meth addiction. And what helped me was healing my gut-brain axis. And what is our gut-brain axis? Science now tells us that we have a second brain. There has been massive scientific shift towards our microbiome, which is in our gut. It's our largest immuno organ. It's called the microbiota. And 90% of our cells is actually non-human. Only 10% of our cells is human genes, and the rest is all bacterial genes. The microbiome is an ecological community of trillions of bacteria living symbiotically on our body. Symbiotically means in harmony and like in homeostasis. And how important is our microbiome? Our microbiomes is actually what helps communicate with our brain to regulate everything in our body, where it's health, weight, immune function, digestive function, mood, and overall mental health. What we put in our bodies, of course, this relates to a lot about what Maria and Cheryl talk about, food and water. What we put out in our bodies affects the microbiome, which in turn affects our mind and other crucial bodily systems. In balance, we're feeling great. We have what we call vigor instead of burnout. Vigor is the opposite of burnout. It's where you have mental energy and physical energy at the same time. And this also explains why we always get that gut feeling. Sometimes we don't listen to our gut, but actually the best thing to do is always just trust our gut. Our gut knows best. How do our two brains communicate? So our two brains communicate on an axis. I don't know if you guys can see this picture. So this is the axis. And what the network consists of wires, which is our nerves, and chemicals. 98% of our neurotransmitters is actually produced in our gut and not our brain. It's produced in our gut and gets sent to our brain. And our cells in our gut is what makes up the immune system. So the nervous system is our brain, the immune system is the axis, and our GI system is our gut. And that works together to balance out the microbiomes, produce hormones, and healthy neurotransmitters. Balancing the gut with nutrition. So this goes in part to what Cheryl is teaching us. Our food is our mood. Good gut. The three important bacteria that we need are probiotics, prebiotics, and phytobiotics to balance our gut, to have more good bacteria than bad bacteria. Good bacteria and probiotics, it supports mental wellness, aids digestion. Foods you can eat, fermented foods, yogurt, kefir, kimchi, kombucha, sauerkraut, miso, tempeh, and probiotic supplements. What's heavy in prebiotics is foods like asparagus, bananas, green leafy vegetables, garlic, leek, onion, chicory, ginger, and prebiotic supplements. Prebiotics, they help fuel source and encourage growth of beneficial bacteria. Phytobiotics, foods are rich in flavonoids which protect good bacteria and establish a hospitable environment for the growth of good and displacement of bad bacteria. Good food to eat for that is apples, grapes, dark chocolates, and berries. And then lifestyle choices. How we live is important. We need to make sure we get adequate sleep. Bad sleep can lead to poor mental health, higher stress levels, weight gain, and everything else. Mindfulness, practicing meditation, or whatever you do to have peace and calmness. It could be reading the Bible, it could be doing yoga, it could be taking a walk, it could be whatever you want. And then physical activity, regular exercise. All we really need to do is move our body at least 10 minutes a day. If you're a type of person who is just wanting to work out, don't have that motivation, just move your body 10 minutes a day, every day, and that will actually help you with reducing stress, anxiety, and everything else. And then, and what is your gut healthy? A healthy status gut, you have normal behavior, cognition function, and you have a balanced emotional state. You have healthy levels and inflammatory cells and or mediators, and you just have a lot of those good microbiomes in your gut. You don't get that bloating or that tiredness or that comes with overeating or anything, or just bad bacteria. Unhealthy status gut is alterations in behavior, cognition, emotion, like just very moody, altered levels of inflammatory cells and or mediators. That's why we see a lot of autoimmune disorders, come into play. And intestinal dysbiosis, that's where you see your like digestive issues like Crohn's disease, celiac disease come into play. Once we really get our bodies to have more beneficial bacteria than the bad bacteria, you'll see your body start healing and start reversing itself. I know that's what happened to me. I hit rock bottom in 2019. I was not a binger. I was a daily user. I was at my heaviest weight, and I really didn't think that I would find a solution to get out of drug addiction and my mental health. I smoked daily for 10 years, and as we all know, meth is the devil's drug. So being able to say that I beat drug addiction just by paying more attention to my gut health and being more just eating better and moving every day, I was able to overcome drug addiction, and my mental status, my emotional state is more balanced. I'm not saying that I'm 100% better. Every day is a struggle, and I still have to be very mindful and everything, but there is now a solution, a holistic solution that can help people just get through their days a little bit easier, have that more natural motivation, that natural focus, that natural mood enhancer, just by healing that axis between our brain and gut. So yeah, this is the end of my presentation. If you guys would like me to connect with me, just to share more of my story, or you would like to learn more about how you can get your gut-brain axis back into balance, I'll be leaving my information in the chat box. Thank you. I don't know who's asking me.
Hello. Hi. Thank you. Thank you, Marianne. Can everybody hear me? Thank you, Marianne. That was very, very beneficial, touching on the whole gut health and the becoming over your addiction. That was for a lot of people use drugs to, I remember when I did, was to lose weight, and to know that you took a natural way out as opposed to trying to go the easy way out, because there's a number of reasons why people do use drugs. And my hat's off to you, and you're a benefit to us, to this chamber, as well as to everyone out there with it. And when we talk about mental health and drug addiction and substance abuse, all of that ties in together. Environmental, everything does. So what we must be very aware, as well as our eating habits, what we're putting in our bodies, all of that makes a difference. Up next, we have health, wealth, and wellness, and that's going to be Mrs. Opa J. Price. She's going to be talking about solutions for financial stress and improving your health and wealth. Ms. Opa, are you there?
Yes, I am.
Thank you. Welcome.
Hello.
Hi.
I apologize. I'm having some camera issues today, okay?
Still going.
Thank you. It's so good to be here. Yes, I want to talk about your financial health and wellness. When you ask yourself, well, what does wealth have to do with my wellness? It has everything to do with your wellness. Being financially fit and in a position where you can handle your health. And when I say health, I'm talking about doctor visits, medical, dental, all of that. If we need mental health, we have finances to handle that. There are 5 essential elements to well-being. One would be career well-being. The other would be social well-being. There's financial well-being, there's physical well-being, and there's community well-being. Well, I want to talk about the financial well-being. And what financial well-being means, being effectively managing your economic life. When you think about, you know, as a family, and I can think back to when I was a young single woman and I had 2 kids, okay? Just to give you an example, when the bills are due, we have mortgages that have to be paid. We have car notes, all of that. And when we're not financially fit to handle those things, it preys on our mental well-being. And I can think back to a time in my life, you know, being a young mom, having, you know, my car note due. And I had just gone through a divorce. I had 2 small kids. And I cannot tell you how that stressed me out so much. Number one, you're going to lose sleep behind those situations. You're constantly worried about how you're going to do this. And people don't realize it takes toll on you mentally. It takes toll on your well-being because you're constantly trying to figure out how are you going to handle that situation. And one of the solutions for that, when it comes to, you know, making sure that you're in a position to pay your mortgage, to pay your car note, to handle your everyday bills, is that we have to have an emergency fund. We have to have money set aside so that we can handle those issues. Well, we can reach out and go to the doctor and pay for our medical expenses. A lot of us are self-employed. We're not on a corporate job. And I must tell you that when you look at the statistics, corporate companies have a lot of these programs in place for their employees. But when you're self-employed, guess what? When you walk out and decide you want to be self-employed, you want to be your own boss, that means you have to take all of that with you into consideration. How am I going to handle my, you know, medical situation? If I don't have health insurance, how can I function every day? And I can't tell you the amount of people that I talk to and they got, you know, personal issues going on. You know, they may have, you know, stomach problems. They may have high blood pressure, all of these things. And the first thing they'll say to me is, you know, I can't go to the doctor. I don't have any health insurance. How can you lead yourself in business if you're not medically prepared? Because it may not affect you right then and there, but trust me, it will affect you down the road. So having an emergency fund in place as a business owner, that means 6 months to a year of money put away so that you can take care of your health, take care of situations like that. Dental, a lot of us don't handle our dental, issues. We walk around with a toothache, we walk around with infected teeth, and the first thing we'll say is, you know, I don't have dental coverage. And that's not a good way to be. If you're self-employed, you have to take care of you got to take care of yourself first, or that business is not going to mean anything. So we must have what we call an emergency fund. The other thing is that we have to spend within our means. And what I mean by spending within our means, well, if I can't afford to go out and buy that $50 dress, then I know I have to think twice about buying that dress. And so we have to stay within our budget. And those are some of the things that's going to help keep us on track, because when we're not on track and we don't have the funds to do those things or to handle those personal things that are affecting us, it is going to wear and tear on us. You know, because I can't tell you, just by having to pay my car note, I could not sleep at night. And at that point, I was working a full-time job. I couldn't sleep. I had to go to work the next day, you know, because it's called poor planning. I couldn't sleep at night. I couldn't function. It's constantly on your mind that this is in the back of your mind. This is something you have to do. So having an emergency fund will take care of that. The other thing is that you have to be prepared when you're self-employed and you're out running your own business. I will always tell people, take care of yourself first. If you have your emergency fund going for yourself, you have a plan for yourself, you have to plan. The other thing is that we have to have access to resources. And I notice in a lot of our communities, a lot of times we don't know what those resources are. We don't know how to get access to those resources that can help us out. And those are the things that are going to help us through those tough times. Even if we have to go get assistance, get some kind of help, some kind of way, we have to do that rather than walking around with a toothache or walking around, you know, without medical coverage, because it's going to cause heck on our bodies. When you think about dental coverage and all of that, and having issues with your teeth, believe it or not, that causes your blood pressure to go up. Those are things we don't even think about. We don't think about how it's affecting us physically and mentally. So I encourage my clients, I encourage our community to take care of that first, especially if you're working for yourself. Of course, corporate is going to offer it to you. That's a part of your benefit. But we have a tendency to put those things on the back burner when we are self-employed. And over a period of time, it is going to cost us heartache. It's going to cost us, make the illness greater than it is. We talk about having benefits. You know, cancer is really high right now. And, you know, so we have to have programs to handle that. Because one of the main things that rides on this is that we don't have the adequate income, or we don't have the proper funds to deal with those situations. Okay, so having the proper benefits in place is really the way to go. And you know, a lot of times people say, well, I don't have the money to do this. What we really do is kick the can down the road. Because you have the money, it's just a matter of where you're going to pull it from. But those are the things that's going to help you in the long run. When medical issues come up, that you have to go in the hospital, you have to end up in the emergency room. And if you're self-employed and you're a self-provider and you pull yourself out away from your business, guess what? More bills are going to pile up. More situations come. So we have to prepare ourselves. One is having the emergency fund, having a plan in place. We have to plan for 6 months to a year ahead. The other thing is looking for the resources in our community. What is available there that I can get help? And I think, you know, having the pandemic being the way it has been for the last year and a half, I just sit back and I look at the amount of things that have happened. We have had people committing suicide. Why? Because they've been taken away from their jobs. Suicide. I mean, so much, you know, these massive shootings, so much is going on because people have been taken out of the norm. So what I encourage my clients to do or in the community is highly prepare yourself. Being financially fit will help you through those tough times. Okay, and it will help keep that stress level down. It will help prepare you to continue to do what you're doing. Having the proper benefits. You must have health insurance. You got to have life insurance. And I know a lot of us have lost a lot of loved ones during this pandemic. I know I have. And, you know, it's very stressful. It's emotionally draining. But knowing that you have a plan in place, and if those things happen, how you can handle those things, because we're going to grieve. That's something we can't get through. We're going to grieve. We're going to hurt. But having a plan in place and have adequate funds that will help take care of that will make that process even easier. So you got to have life insurance. You got to have health insurance. You got to have dental coverage in place. And then you have to have a plan for yourself. You have to plan for your future. You have to plan. It doesn't matter how old you are. You have to think about where you are right now. You know, a lot of us have a tendency, we want to live in the moment. We're not thinking about what we need to do down the road. And I always tell people, you know, when you're younger, time is on your side. You're at that age when you can do a lot of things. But once you get to a certain age, you have really got to be thinking about, how do I want to end up with my life? How do I want to retire? Do I want my income to stay the same as it is right now? Or do I want more? Retirement to me is that golden time in my life where I want to travel. I want to do things. And it really hurts when the reality sets in. We can't travel because we didn't plan. Or we have to go out and get a second job. And that's very stressful. So we have to plan ahead. We have to have a game plan for ourselves. We have to have a map. And, you know, I always tell people, it's putting that little bit away. You don't have to, you know, people, a lot of times they don't invest or they don't put money away because they're thinking I have to have a whole lot of it. No, if you plan it right and you do it the right way and do it at an early age, you can reach that goal. And you'll be surprised at just putting a dime away every day, what that money will accumulate. So you have to be thinking about, if you're self-employed, I have to take care of me. I have to take care of my own retirement. I have to take care of my self-help. And I need to have means in place to get that done. And right now is a really great time to do that. You know, you have Covered California, where, you know, the president has lowered some of those costs. So for a person to walk around today without health insurance and not to be protected, there is no excuse for that. There's no excuse for that. So I encourage each and every one of you, anyone listening that don't have proper coverage in place, plans in place to help protect yourself. I have information in the chat box. Contact me. We have options. We have programs that you can actually get into. So I want to see everyone take care of their health. You know, we have exciting businesses out there, but if our health is not where it needs to be, none of that means anything. None of that means anything. So thank you guys. I really appreciate being able to be on here tonight. I look forward to more of these because this is what we need. This is what we need to talk about in our community. I listened to Regina earlier, Cheryl, and everyone that has really had something really valuable to say tonight. I can just say that in my family, I have homelessness in my family. I have mental illness in my family. And the things that Regina, you're talking about, it's never too late. There's always a chance to turn it around. And these people need help. And what you said about Obama, when he signed the bill in for the homelessness, and they took that money and misused that money, that hurt me a great deal because I know our people need that help. And it's not just about getting them off the street or bringing the homeless off the street. It's about finding out what their needs are. How can we help them mentally get back on track? So I thank you guys. I really want to see more of these conversations because they're well needed. Let's stay healthy. Let's take care of ourselves. And let's make sure that we all are feeling well. Thank you.
Thank you, Opa. Thank you very much. Thank you. That was beautiful. And to tie it in, yes, we lost a family member due to COVID, my sister-in-law. She was my age and we lost her. And just to piggyback off of that, my brother had insurance, but he had it through the job. So sometimes we think that, okay, well, I got it through the job. There's a period of time that you have to wait, you know, before it goes into effect. So some people think that, you know, well, I'll get the insurance today and, you know, maybe next year, you know, something happened next year, you know, it'll be okay. But that wasn't the case. We had to do GoFundMe. I mean, they got a lot of money because she was a beautiful woman, but regardless of that, if she had not been the person she was, I don't know what we would have did with burying her because his insurance did not kick in. So just to piggyback off of that, you guys, really, insurance is one thing I need to get on point with, and also with saving money, because your health, your wealth, what will drive you absolutely crazy is when you can't afford to make that mortgage, or when you can't afford to take care of your family, or when you can't eat. I experienced that hungry days. So hungry will make you. Yeah. Are you ready now, Shush?
Exactly. Okay. Well, thank you guys, and we will make sure that we have information in the chat for you. Okay.
Thank you, Miss Opa.
You're welcome. Thank you.
Great. Yes, I am ready. Thank you. Thank you. Okay, can you guys see me okay?
Yeah.
You can? Okay, so.
Your beautiful logo, that's what we see.
Oh, thank you. Let me see, I am, stop video, I'm on here, am I here? Hi.
Sure. Hey. I wasn't
Hey.
sure if you're gonna do engagement right now, or we're gonna go into you right now.
I don't know. We could do some engagement.
We're going straight into the cooking demo. We are behind schedule, so straight into the cooking demo, and then we'll do the raffle last.
Okay. All right. Thank you. This is my little segment where I get to talk about health and wellness from a food perspective. Okay. So, you know, I've been doing this for quite some time. I do enjoy it, but I'm always learning about food because, as we know, food will heal you.
You know, there's some things that, there's drugs, there's wonderful things, but you know what? Anything that comes from the earth, if we know about it, it will heal you. So in my studies of being a chef and just learning how food helps people, I discovered that eating leafy green vegetables daily, I'm gonna say that again, eating leafy green vegetables daily will help your cognitive abilities later in life. And what it will do is it will take 11 years off your cognitive abilities if you are eating leafy greens every day. I'm gonna repeat that, okay? If we eat leafy greens every day, if we got those collards going, if we have a kale salad, if we have some spinach, we have some romaine lettuce, if we're eating that every day, let's say a 75-year-old person was greasing cornbread every day, okay, at 75, they're probably thinking like a 64-year-old person because they have taken in those leafy green vegetables which are oxidative. You know, green is chloroform, so that's oxygen in our body, which is of course when we need that, hydration and all. But just remember that, leafy green vegetables. And what I do for my clients every time I'm cooking for them, I'm doing a leafy green vegetable, okay? So I have some beautiful collards here. I'm not going to use them, and I just want to show you. You know, there's a garden that we're going to be going to over on 104th in Vermont. If you go there, please get some collards. Get some collards. Your life will be so much better if you get some, and there's plenty of them, okay? I'm going to demonstrate a couple ways that we can use kale. Now, kale is, you know, they call it a superfood. It's collard's cousin, okay? You know, in the family of greens, kale is collard's cousin. It's not something that we should eat every day because the iodine level can be kind of high. So I would suggest that if you eat this, eat it in moderation. Okay, maybe 2 or 3 times a week or something like that. Or if you binge, it's okay, maybe once or twice a week. But just, you know, moderation, moderation. It's not something, don't run out and eat a kale salad every day, excuse me, okay? So kale can be torn off the leaf, okay? It's a beautiful curly vegetable here. You want to tear it off the leaf. You don't have to cut it. It's best to tear it with your hands, okay? Now I'm gonna do a couple things with this kale, but how I'm gonna get it off the stem is I'm gonna tear it off, right? Hope you guys can see me, okay? So we're gonna tear it off the leaf, we're gonna tear it off the stem, and we're gonna have a bowl of torn up kale, okay? Now, kale in this state is hard to digest, so we have to break it down, okay? And we know that lemon is an acid, okay? Lemon will break things down, it will cook them. If we know ceviche in the Hispanic culture, we know they have shrimp, and you can put lemon on the shrimp, and that will cook the shrimp to at least a level that you can eat it. Okay, so the same thing applies here. We're gonna put some lemon on this kale, okay? And we're gonna put some olive oil, okay? Now this is gonna make it palatable to eat. And again, like I said, kale is curly. There's a lot of surface space to the leaf, okay? So what we're going to do, excuse me, I have one hand, because been a little damaged, so I'm gonna wear a plastic glove. But what I'm gonna do is I'm gonna massage this kale, okay? Now, one of the things that I always talk about is cooking. We need to be back in the kitchen cooking. Everything that we talked about for this past seminar is wonderful. Your gut brain, your hydration, youth, everything. But if you're not in the kitchen cooking, we can kind of throw all this stuff away. I mean, I really have to impress on you that this is where you can control your life by what you eat, okay? And if we are in the kitchen cooking, you are literally you know, you're the master. You're the master of the family, because whatever it is that those people are eating that you put in front of them is what's going to nurture them. Okay. So when I massage this kale, I'm thinking of all the wonderful things that my family or whoever this is eating it is going to receive. So I'm putting good energy into this food right now as I'm massaging. Okay. Intention is everything. Okay. So as I'm massaging this, I'm saying, okay, I want whoever it is that's going to eat this to be nourished and to be wonderful. Okay. So we're going to massage this kale. It's okay. That's why they always say when you cook, you need to be in a good mood. Because if you're in a good mood, that is what goes into the food. All right. And another reason why you should be preparing it yourself. Okay. I don't want to tell the story of, gosh, my goodness, that person in the drive might not have had a good day. Okay. So if you hadn't had a good day, and you're just not going into that taco. All right. But we have this wonderful massage kale. Okay. So we're going to do one of two things. One, I'm going to make a salad. Two, I'm going to roast some of this. And not necessarily roast some of it. I'm going to dehydrate it some. Okay. So I didn't have to put any lemon on it, but it's got a little lemon flavor on it. And that's okay. That is okay. Okay. So take this glove off. We're going to put some salt. I'm going to salt both of them. Both need salt. This is Himalayan pink salt, 84 minerals and trace elements. It's the purest form of salt. That's what you should have in your cupboard, in your pantry. Okay. So we're going to take some of this kale and we're going to put it on a cookie sheet, on a baking sheet, and we're going to spread it out. Okay, I hope I have enough time for this. Okay. And we're going to roast this for about 10 minutes. Hopefully I have 10 minutes. Okay. But what we're going to do with this kale that we have left is we're going to make a salad. Okay. So here we have kale, and it's literally a blank slate. Okay. We have kale that is ready to eat. Okay. It has lemon, it has olive oil on it, and a little bit of seasoning. Okay. So it's a blank palette. The kale salad can be anything that you want. Okay. I like a kale salad. I like fruit. Okay, I'm a fruit person. So what I have here are some wonderful raisins that you can put in. I like fruit. So, you know, because kale is kind of like, it's a little on the bland side, so I like to bring it up. Okay, so we're going to put raisins in here, and we're going to put in some apples. All right, so one good tip for when you're cutting apples is put them in lemon water, because we do understand that apples oxidate. First thing they do is turn brown. When you buy the apple, put it down, it's going to turn brown. So it oxidates. Put them in lemon water. And it doesn't have to be a whole lot of lemon, just some lemon and some water. Okay. So this is what I had a little earlier when I cut from. And you can see that this has some oxidation on it. Okay. So I'm going to take this, cut this up. What I may do is just and go on and fire up my kale, and instead of making it dehydrating, I will just roast it, because we don't have a lot of time. Okay, so what we're going to do, we have kale. We have raisins. Remember I said our kale is ready to eat. So we're going to take our apples. Okay. Color is so important when you're cooking. You want food to be attractive, because you eat with your eyes. You eat with your eyes first. So if you see something, especially when you're going to a restaurant and the food is placed in front of you, the first thing you want to do is go, wow, that looks good. I can't wait to dig in. So that's what one should think even when we're at home and we're cooking for our family and we make them a plate. Think a little bit about how it looks to them when you put it in front. I know kids, sometimes they don't like vegetables or too much, but if you fashion them in a certain way, they'll like it. Okay, if you kind of put them in certain shapes, they'll eat it. Okay, they should be eating well. Kids need to eat a balanced diet. Okay, and again, I can go on and on, but I really need to emphasize that getting back in the kitchen is what's really going to save your health and your family's health. You know, I cannot impress enough. When I grew up, I had somebody cooking for me. There was always somebody that gave me a plate. Okay. And so, wow, you know, I was trusting of that person because I knew that they were going to take care of my health. Okay. So, with that being said, cook for your family. You know, cook for them. You know, love them that way. You may not say you love them, but give them a good plate of food. They'll know that you love them behind that. Okay. So, we have this wonderful salad. Like I said, it's good the way it is. We're going to make a salad dressing. Now, salad dressings, if you go into the stores, you see a great big department of them. Salad dressings are, they're just really two things. They're oil and vinegar, and everything else is just fluff. Okay, oil and vinegar. You need an acid and you need a fat. Okay, so let's say we make a salad dressing out of butter and oranges. That's an acid and a fat. Still the same principle. Okay. Of olive oil, because that is the key ingredient that I have in my kitchen. I don't leave home without it. This is what I have all the time. And of course, we'll you know, in cooking classes to come, we'll talk about having a good pantry. But here we have an oil, which is a fat, and an acid, which is vinegar. Okay, so this is white wine vinegar, olive oil, agave nectar, just for a little bit of sweet. Okay, and Dijon mustard. Okay, this is a basic salad dressing. It works every time. You can take this salad dressing and put everything in it or nothing in it because it's good all by itself. Let's say if you wanted to make a ranch dressing out of this, you can introduce some Greek yogurt and some more spices, and there's your ranch. Okay, you don't need to go in the grocery store and get that thing off the shelf because it does have preservatives in it. Everything here is in your cupboard. You can mix it together. You can put it in your refrigerator. And if you're eating salads like you should be every day, it won't last very long. Okay, so this is our mixture of olive oil, white wine vinegar, blue agave, and some mustard. Okay, that's a standard recipe. Okay, so this right here is wonderful. It's a wonderful salad. One thing I can tell you about kale is that it's a hardy leaf. So after dressing this salad, it can sit or it can go in your refrigerator. It will last for about 2 to 3 days just with the salad dressing on it because the kale is gonna, it's gonna soak it up, but it's not going to be wilted. It's not gonna be wilted. Okay, so guys, okay, you know how you do on the cooking shows, you have to try it, okay? Very, very good. Very good, okay? And again, I'm an apple and a raisin person, so this is wonderful, along with the kale. And this salad dressing is a little bit on the sweet side, so it's awesome. Let's look at our kale. Excuse me. Okay. Oh, I don't really have a whole lot of time, but I want you to see this kale. I don't think we have a lot of time for it to stay in the oven, but this is going to turn into a chip.
Mm-hmm.
Kale chips are awesome.
Delicious.
Again, it's still green. It's still green leafy vegetables. So, and this is in different ways. So, again, I want you to remember this. If you remember anything else today, okay, to eat your green leafy vegetables at least once a day and you will have better mental health. Okay? I thank you so much. I am a personal chef. I am here for you. And I think that's about it for me. But I think this is the end of our webinar. I know we have a raffle. We have time for our raffle, Dexter?
Yes, we are going to do a raffle. Hang on, I'm going to go off of Facebook. So thank you all for joining this evening. Great information from all the speakers and presenters this night. Health is your best asset.
Yes, it is.
So thank you all, and hang tight for those that's on Zoom. We are going to do our raffle. Have a good evening.
Thank you so much. Wow.